The morning started like any other Tuesday for King, a beloved community leader and father of three from Springfield. At 52 years old, had built his reputation as someone who always put others first. Whether organizing charity drives for local families or volunteering at the community center every weekend, he was the kind of person everyone could count on. His friends often joked that had never met a stranger, and his warm smile could light up even the darkest rooms. Had been feeling unusually tired for several weeks, but he brushed it off as the natural result of his busy schedule. Between his demanding job as a school principal, his volunteer work, and helping his elderly neighbors with their daily tasks, exhaustion seemed like a reasonable explanation. His wife, Sarah, had been gently suggesting he slow down, but was stubborn about taking care of himself when others needed his help. The fatigue gradually became more noticeable. Simple tasks that used to handle with ease now left him breathless and drained. Climbing the stairs to his office at school became a challenge, and he found himself needing to sit down frequently during his daily walks around the neighborhood. Sarah noticed that her husband was going to bed earlier and struggling to get up in the mornings, which was completely unlike the energetic man she had married 28 years ago. One particularly difficult morning, collapsed in his kitchen while preparing coffee. Sarah found him sitting on the floor, confused and pale, unable to explain what had happened. Despite his protest that he was fine and just needed to eat something, Sarah insisted they visit their family doctor immediately. The drive to doctor's office was filled with worried silence, both of them trying to convince themselves that it was probably just stress or maybe a minor health issue that could be easily fixed. Doctor had been the King family's physician for over 15 years and knew well. After a thorough examination and hearing about the recent symptoms, he recommended a series of blood tests and a more comprehensive physical evaluation. Reluctantly agreed, though he kept insisting he felt better and was probably just overworked. The doctor's concerned expression, however, suggested that something more serious might be developing. The blood work results came back 3 days later, and doctor called personally to schedule an immediate follow-up appointment. This was unusual, as test results were typically shared during regular visits or through the patient portal. Sarah accompanied to this second appointment, and they both sensed the gravity of the situation from the moment they entered the examination room. Doctor sat across from them with a serious expression and explained that the blood tests had revealed some concerning abnormalities. The white blood cell count was significantly elevated, and there were other markers that suggested a possible blood disorder. He recommended seeing an oncologist as soon as possible for further testing and evaluation. The word oncologist hit both and Sarah like a physical blow, even though doctor was careful to explain that many blood disorders were treatable and not necessarily cancerous. The referral appointment was scheduled for the following week, but those 7 days felt like an eternity for the King family. Tried to maintain his normal routine, continuing his work at school and his community activities, but the uncertainty weighed heavily on everyone's minds. Their 3 children, now adults with families of their own, around their parents, offering support while trying to manage their own fears and concerns about what the tests might reveal. Sarah found herself researching blood disorders online late at night, though she tried to focus on the positive outcomes and success stories rather than dwelling on the more frightening possibilities. Characteristically, spent his time thinking about how to handle the situation if the news turned out to be serious, already planning how to minimize the impact on his family and community responsibilities. The oncology appointment took place at the Regional Medical Center, a large facility that specialized in cancer treatment and blood disorders. Dr. Williams, the hematologist-oncologist, was a kind but direct physician who explained that additional tests would be necessary to determine exactly what was causing symptoms and blood abnormalities. These tests would include a bone marrow biopsy, CT scans, and more detailed blood work. The bone marrow biopsy was scheduled for 2 days later, and approached it with characteristic determination, though Sarah could see the worry in his eyes. The procedure itself was uncomfortable but manageable, and Dr. Williams explained that the results would provide crucial information about what type of blood disorder they were dealing with and what treatment options might be available. While waiting for the biopsy results, made a decision that surprised everyone, including himself. He decided to be completely open about his health situation with his school community and the organizations where he volunteered. Rather than keeping the uncertainty private, he chose to share what was happening and ask for prayers and positive thoughts. This transparency was typical of his honest and straightforward nature, but it also reflected his understanding that hiding the situation would be more stressful than facing it openly. The response from the community was overwhelming and immediate. Teachers, students, parents, and community members reached out with messages of support, offers to help with daily tasks, and promises of prayers. Was deeply moved by this outpouring of love, though he remained focused on getting through the diagnostic process and learning exactly what they were dealing with. 3 days after the biopsy, Dr. Williams called with the results. The conversation was brief but life-changing. Had been diagnosed with a form of blood cancer called chronic lymphocytic leukemia. The doctor explained that while this was indeed a serious diagnosis, this particular type of leukemia was often manageable with proper treatment, and many patients lived full, active lives for many years after diagnosis. The initial shock of hearing the word cancer was intense for both and Sarah. Despite Dr. Williams's reassuring words about treatment options and positive outcomes, the reality of facing a cancer diagnosis felt overwhelming. However, his natural optimism and faith began to surface almost immediately, and he found himself asking practical questions about treatment, timeline, and what this would mean for his daily life and responsibilities. The drive home from the oncology appointment was quiet, filled with the weight of processing what they had just learned. And Sarah held hands as they navigated the familiar streets of their neighborhood, both lost in their own thoughts about what a cancer diagnosis would mean for their future. When they arrived home, they sat in their living room for nearly an hour, sometimes talking through their fears and sometimes just sitting in comfortable silence, trying to absorb the reality of their new situation. His first instinct was to research everything he could about chronic lymphocytic leukemia. He spent hours reading medical websites, patient testimonials, and treatment information, determined to understand exactly what he was facing. Sarah worried that he was overwhelming himself with too much information, but she recognized that learning about his condition was a way of regaining some sense of control over a situation that felt entirely out of his hands. The couple decided to tell their children about the diagnosis in person rather than over the phone. They arranged for all 3 kids to come for dinner that weekend, though they didn't explain why the gathering was so important. Wanted to be able to see their faces when he shared the news and to immediately reassure them about the positive aspects of his particular diagnosis and treatment plan. Saturday evening arrived, and the house filled with the familiar sounds of family conversation and laughter. Their oldest daughter, Jennifer, had brought her 2 young children, while their sons, David and Michael, arrived with their respective partners. The normal family dynamics felt especially precious to and Sarah, knowing that this dinner would mark a significant transition in all of their lives. After everyone had finished eating, asked the family to remain seated because he had something important to share. The room grew quiet, and could see the immediate concern on his children's faces as they sensed the seriousness of the moment. He began by explaining the fatigue and symptoms he had been experiencing, then walked them through the doctor visits, tests, and ultimately the diagnosis he had received just days earlier. The initial reaction was exactly what Sarah had expected: shock, tears, and an immediate flood of questions about treatment, prognosis, and what this meant for the future. Spent considerable time explaining what Dr. Williams had told them about chronic lymphocytic leukemia being a manageable form of cancer, emphasizing that many people lived normal with proper medical care, and that his particular case seemed to be caught relatively early. Jennifer, always the practical one, immediately began asking about second opinions, treatment centers, and whether was confident in his medical team. David wanted to know about symptoms to watch for and how the family could best support his father through treatment. Michael, the youngest and most emotional of the 3, struggled with the news but was comforted by his father's calm demeanor and obvious determination to fight the disease. The conversation continued late into the evening, with family members sharing memories, expressing love, and gradually moving from the shock of the news toward practical planning and emotional support. Was touched by how quickly his children shifted into protective mode, already discussing how to adjust their schedules to spend more time with him, and how to help Sarah manage the additional stress and responsibilities that would come with his treatment. Over the next few days, began the process of informing his wider circle of friends, colleagues, and community members about his diagnosis. He decided to write a letter that could be shared with his school community, explaining the situation honestly while emphasizing his optimism about treatment, and his intention to continue working as much as possible during his medical care. The response from the school was immediate and overwhelming. Teachers, staff members, students, and parents reached out with messages of support, offers to help with administrative duties, and expressions of love and encouragement. Was particularly moved by the letters and drawings he received from elementary students, whose innocent but heartfelt messages reminded him of why he loved working in education and how much his community meant to him. Dr. Williams had scheduled for additional staging tests to determine the exact extent of the leukemia and develop a comprehensive treatment plan. These tests included CT scans of his chest, abdomen, and pelvis, as well as more detailed blood work to assess how the cancer was affecting various organ systems. The staging process would help determine whether needed immediate aggressive treatment or whether a more conservative approach would be appropriate. The staging tests revealed that leukemia was in the early stages, which was encouraging news. Dr. Williams explained that many patients with early-stage chronic lymphocytic leukemia could be monitored closely without immediate treatment, a strategy called watch and wait. However, given symptoms and some specific characteristics of his particular case, the doctor recommended beginning treatment sooner rather than later. The treatment plan involved a combination of oral medications and periodic intravenous therapies that could be administered on an outpatient basis. Dr. Williams explained that this approach would likely control the leukemia effectively while allowing to maintain much of his normal routine, including continuing his work as a school principal, though with some modifications and increased attention to his health and energy levels. Felt relieved to learn that his treatment wouldn't require hospitalization or force him to completely step away from his responsibilities. However, he also understood that the medications would likely cause some side effects, and he would need to be more careful about avoiding infections and managing his energy. Sarah began researching ways to support someone through cancer treatment, focusing on nutrition, stress management, and creating a healing environment at home. The couple also began exploring support groups for blood cancer patients and their families. Dr. Williams had recommended several local organizations that provided education, emotional support, and practical assistance for people dealing with leukemia and related blood disorders. Was initially hesitant about joining a support group, feeling that his natural inclination was to be the one providing support rather than receiving it. But Sarah encouraged him to consider how connecting with others in similar situations might be helpful. As word of diagnosis spread through their community, the outpouring of support continued to grow. Friends organized meal deliveries for the family, neighbors offered to help with yard work and household tasks, and colleagues stepped up to handle additional responsibilities at school. This community response reinforced decision to be open about his health situation rather than trying to manage everything privately. Also began thinking about how his cancer diagnosis might affect his long-term goals and priorities. While Dr. Williams was optimistic about the treatment outlook, recognized that facing a serious illness naturally led to reflecting on what mattered most in life. He found himself appreciating daily moments with Sarah more deeply, treasuring time with his children, and thinking about the legacy he wanted to leave through his work and community involvement. The first treatment session was scheduled for the following week, and approached it with a mixture of nervousness and determination. Sarah planned to accompany him to all of his medical appointments, and they had arranged for flexible work schedules that would allow them to manage his treatment while maintaining as much normalcy as possible in their daily lives. The Cancer Treatment Center was a modern facility designed to feel as comfortable and welcoming as possible, but still felt nervous as he and Sarah checked in for his first treatment session. The waiting room was filled with other patients and their families, creating an atmosphere of quiet solidarity among people facing similar challenges. Notice the mix of ages and backgrounds, reminding him that cancer didn't discriminate and that he was joining a community of fighters he never expected to be part of. Dr. Williams met with before his first treatment to review the medication protocol and discuss what to expect during the coming weeks. The treatment plan included both oral medications that would take daily at home and intravenous medications that would be administered at the treatment center every few weeks. The doctor explained that most patients tolerated this particular combination well, though some fatigue and increased susceptibility to infections were common side effects. The first infusion took several hours, during which sat in a comfortable reclining chair while the medication slowly entered his system through an IV line. Sarah brought books, magazines, and snacks, and they spent the time talking quietly, reading, and observing the other patients and families around them. Was struck by the resilience and positive attitudes he witnessed, as people facing serious illnesses found ways to laugh, support each other, and maintain hope. During that first treatment session, met several other patients who became important sources of encouragement and practical advice. An elderly woman named, who had been managing her blood cancer for over 5 years, shared tips about dealing with fatigue and staying positive during difficult days. A younger man named Robert, who was further along in his treatment, offered insights about balancing work responsibilities with medical care and the importance of listening to his body's signals. The side effects from his first treatment were milder than he had anticipated. He experienced some fatigue for a few days after the infusion, but nothing that prevented him from continuing his work or daily activities. The oral medications caused occasional nausea, but this was manageable with anti-nausea medication and careful attention to eating regularly and staying hydrated. As settled into his treatment routine, he began to find unexpected positive aspects in his cancer journey. The forced slowdown in his typically hectic schedule allowed him to spend more quality time with Sarah, and they rediscovered the pleasure of long conversations, quiet evenings at home, and simple activities they had often rushed through in the past. His children visited more frequently, creating opportunities for deeper family connections and shared experiences. The school community continued to rally around in remarkable ways. Teachers volunteered to cover additional responsibilities, parents organized fundraising events to support cancer research, and students created artwork and wrote letters that filled his office with colorful reminders of love and hope. The principal found that his openness about his health struggles had actually strengthened his relationships with students and staff, as people felt trusted with something so personal and important. Also discovered a passion for advocating for cancer awareness and early detection. He began speaking to community groups about his experience, emphasizing the importance of paying attention to unusual symptoms and not delaying medical consultation when something didn't feel right. His message resonated particularly well with other middle-aged men, who often tended to ignore health concerns or postpone medical care. After 3 months of treatment, his follow-up blood tests showed significant improvement. The leukemia cells in his blood had decreased substantially, and his energy levels had returned to nearly normal. Dr. Williams was pleased with the response and adjusted the treatment plan to a maintenance schedule that would require less frequent infusion appointments while continuing the daily oral medications. This positive response to treatment brought immense relief to and his family, but it also raised new questions about long-term planning and goals. Began thinking seriously about how his cancer experience had changed his perspective on life priorities and what adjustments he wanted to make going forward. He realized that while he loved his work as a principal, he also wanted to ensure he had time and energy for family, travel, and personal interests that had sometimes taken a backseat to professional responsibilities. The cancer support group that Sarah had joined became an important part of their routine. Meeting monthly with other patients and caregivers provided practical advice, emotional support, and lasting friendships with people who truly understood the challenges and victories of living with cancer. Found that he naturally took on a mentoring role with newly diagnosed patients, using his positive experience and community leadership skills to help others navigate their own cancer journeys. Sarah also benefited significantly from the support group, particularly the sessions designed specifically for caregivers. She learned strategies for managing her own stress and anxiety while supporting, and she connected with other spouses who understood the unique challenges of watching someone you love face a serious illness. The group helped her recognize that taking care of herself was essential to being able to care for effectively. As approached his 6-month treatment milestone, he decided to document his cancer experience more formally. He began writing a blog about his journey, focusing on the positive aspects, lessons learned, and the incredible support he had received from his community. The blog attracted readers from far beyond his immediate circle and received messages from cancer patients and families around the country who found encouragement in his honest but optimistic approach to dealing with the disease. The blog also became a platform to highlight cancer research, share information about early detection, and promote the importance of community support for people facing serious illnesses. He partnered with local cancer organizations to raise awareness and funds for research, turning his personal challenge into an opportunity to help others facing similar situations. His medical team continued to be impressed with his response to treatment and his overall approach to managing his health. Dr. Williams noted that patients who maintained positive attitudes, stayed physically active within their limitations, and had strong social support systems typically had better outcomes, and all of these characteristics. The combination of effective medical treatment, family support, community love, and its own determination had transformed what initially seemed like a devastating diagnosis into a manageable chronic condition that, while serious, didn't prevent him from living a full and meaningful life. His cancer journey had deepened his appreciation for relationships, strengthened his faith, and clarified his priorities in ways he never could have anticipated. 1 year after his initial diagnosis, stood before a crowd of over 300 people at the annual community health fair, preparing to deliver what he had decided to call his good news message about cancer. The audience included medical professionals, cancer survivors, families affected by cancer, and community members who had supported him throughout his journey. Felt a mixture of nervousness and excitement as he prepared to share how his cancer experience had transformed from a source of fear into an opportunity for growth, connection, and service. Began his speech by acknowledging the fear and uncertainty that had surrounded his initial diagnosis. He spoke honestly about the sleepless nights, the worry about his family's future, and the challenge of facing an illness that seemed to threaten everything he had worked to build. However, he quickly transitioned to the remarkable discoveries he had made throughout his treatment journey and the unexpected gifts that had emerged from such a difficult situation. The first piece of good news shared was about the incredible advances in cancer treatment, particularly for blood cancers like his own chronic lymphocytic leukemia. He explained how medications that hadn't existed just a few years earlier had made his particular type of cancer a manageable chronic condition rather than a death sentence. Emphasized that while cancer was still a serious diagnosis requiring ongoing medical care, many people were now able to live full, active lives while managing their disease effectively. Then spoke about the second piece of good news he had discovered, the extraordinary power of community support during times of crisis. He shared specific examples of how his neighbors, colleagues, students, and even strangers had around his family, providing practical help, emotional support, and constant encouragement. This experience had shown him that people were fundamentally good and generous, and that communities could come together in remarkable ways when someone was facing a serious challenge. The third element of his good news message focused on personal growth and changed priorities that had resulted from his cancer journey. He explained how facing a serious illness had forced him to slow down and appreciate aspects of life he had previously taken for granted. His relationships with Sarah and their children had deepened, his appreciation for simple daily pleasures had increased, and his sense of purpose had become clearer and more focused on what truly mattered. Also shared the good news about finding meaning and purpose through advocacy and helping others. His cancer experience had opened doors to connect with other patients, speak to community groups about early detection, and raise funds for research. He had discovered that turning his personal challenge into an opportunity to help others had been one of the most rewarding aspects of his entire journey, giving him a sense that his cancer diagnosis had ultimately led to positive impact he never could have achieved otherwise. Throughout his speech, was careful to acknowledge that not everyone's cancer journey would unfold exactly like his own. He recognized that some people faced more aggressive diseases, had fewer treatment options, or dealt with more severe side effects. However, he emphasized that even in the most difficult circumstances, there were often sources of hope, support, and meaning that could be discovered and cultivated. The audience response to his presentation was overwhelmingly positive. Many people approached him afterward to share their own cancer experiences, ask questions about treatment, or simply express gratitude for his honesty and optimism. Several newly diagnosed patients told him that his message had given them hope and a different perspective on their own situations. Family members of cancer patients thanked him for helping them understand how to better support their loved ones. Following the health fair presentation, received numerous requests to speak to other groups and organizations. He began developing a more formal speaking program that he could present to schools, churches, civic organizations, and medical conferences. His message evolved to include practical advice about navigating the healthcare system, building support networks, and maintaining hope during difficult medical treatments. also expanded his advocacy work by partnering with national cancer organizations to promote research funding and early detection programs. He before state legislators about the importance of healthcare access and insurance coverage for cancer patients. His personal story, combined with his natural leadership abilities and communication skills, made him an effective advocate for cancer-related causes. The blog had started during his treatment grew into a more comprehensive resource for cancer patients and their families. He began interviewing other patients, sharing treatment information, and creating a community forum where people could connect and support each other. The blog attracted attention from medical professionals and cancer organizations, leading to opportunities to contribute to national cancer awareness campaigns. 2 years after his diagnosis, his medical condition remained stable and well-controlled. His regular follow-up appointments with Dr. Williams continued to show positive results, and the side effects from his maintenance treatment were minimal. Had learned to listen to his body more carefully and to adjust his activities based on his energy levels, but overall he was able to maintain nearly all of his normal activities and responsibilities. The King family had also found a new normal that incorporated ongoing medical care into their lives without allowing it to dominate their daily experience. Sarah had become an advocate in her own right, particularly focused on supporting other caregivers and families dealing with cancer diagnoses. Their children had developed deeper appreciation for family time and had made conscious efforts to prioritize relationships and health in their own lives. His work at the school had evolved to include health and wellness education as a more prominent component of the curriculum. He worked with teachers to develop age-appropriate programs about healthy lifestyle choices, the importance of medical care, and how to support community members facing health challenges. His students learned valuable lessons about resilience, community support, and finding positive meaning in difficult circumstances. As reflected on his cancer journey, he realized that while he would never have chosen to face such a diagnosis, the experience had ultimately enriched his life in unexpected ways. He had discovered reserves of strength he didn't know he possessed, experienced love and support beyond what he had imagined possible, and found new ways to contribute meaningfully to his community and to the lives of others facing similar challenges. The good news message that shared about cancer was not that the disease itself was good, but rather that even in the face of serious illness, there were opportunities for growth, connection, healing, and service that could transform a frightening diagnosis into a journey of hope and purpose. His story had become a testament to the power of positive thinking, community support, medical advances, and the human capacity to find meaning and joy even in the most challenging circumstances.